This segment of Delmarva Life is brought to you by TidalHealth.
It is the MVP when it comes to your health, your heart.
And we hear day after day how vital exercise is to keep your heart healthy, but what about if you've recently had a heart procedure? Do the same rules apply? Well, we're getting answers today from Chris Evans and Tammy Donahoe.
They are here to tell us more about TidalHealth's cardiac rehabilitation and adult fitness programs. Thanks for joining us this afternoon, guys.
Thanks for having us.
You. Okay, so this sounds like a simple question. I guess it kind of is. Define cardiac rehabilitation. What is that?
Okay, so cardiac rehabilitation is a supervised program, and our goal is to reduce the risk of further cardiac events for patients that have already had a cardiac event.
Okay.
So we have a multidisciplinary team, which includes physicians, registered nurses, exercise physiologists, respiratory therapists, and registered dietitians. And so our focus is on exercise, education, and counseling, stress management.
And these are medically monitored exercise programs that will strengthen your heart and I guess give you the support you need to live a healthier life?
Correct, yes. Yes, so our patients generally attend 3 times a week and they are on a telemetry monitor. So we can monitor their heart rate rhythm, the blood pressure, blood glucose if they're diabetic. So it's not just a free gym. They're actually being monitored, and they have physicians then that would overlook their telemetry.
Gotcha.
So is it just for the people who have had a heart procedure?
Correct. Most diagnoses that are covered would be patients that have had cardiac events, such as heart attacks, coronary angioplasties, heart failure patients, as well as heart surgery, such as coronary artery bypass graft surgery or any valve repair or replacements.
Okay, so I know that Chris is sitting over there just trying to be pretty, but he's going to answer.
We planned out she was going to handle the first couple questions, and then I was going to jump in. I knew you guys were kind of like, when is he going to say something?
It was a plan. So Chris, tell us who is eligible for this.
For cardiac rehab, anybody for our phase 2 outpatient monitored program, anybody that's had a cardiac event, a recent cardiac event, is eligible with a referral from a physician.
Okay.
So what happens when they're done? What's the next step?
The goal of our phase 2 program is to build that foundation to get them comfortable with, after they've had some sort of event. A lot of times they're not comfortable with themselves or their abilities to exercise or just do their normal daily things. So our goal is to build that foundation, get them comfortable, give them that education to reduce some of those heart risk factors. And then we recommend that they continue that foundation that we've given them to, this is a lifestyle modification, to continue on to our maintenance program or our adult fitness program and continue that healthy lifestyle.
So TidalHealth, of course, in Salisbury.
Absolutely.
But you've got an Ocean Pines location now.
We do.
Tell us about that.
So we do have the TidalHealth Salisbury location, which just recently moved. It is an off-site location, and then we have our Ocean Pines facility as well. So it's located in that health pavilion right by the entrance to the north side entrance to Ocean Pines. It's a maintenance program. It is self-pay. It's not covered by insurance. People can come and go whatever day as long as we're open, Monday through Friday, 7:30 a.m. to 3:30 p.m. They come in, they monitor quarterly now, as opposed to every session, again, just to keep that watch on their heart rhythm.
Right.
And we continue the education, and we continue, a big thing is the social aspect. You're around lots of people that have been through the same thing as you or similar, and you can kind of build that bond with other people as well as the staff.
I understand.
You mentioned the Ocean Pines location. How important is that location to the community there?
It's very important. Ocean Pines is a very strong and small community, tight-knit community. So to have a place for them to build that healthier lifestyle and take care of themselves is very important. It's very important to the participants that attend that location as well.
And I understood you to say anybody can sign up.
For the adult fitness, anybody can sign up with a physician's referral.
Okay.
So as long as they have permission that they can exercise in our program, they can join.
So how do we do that? How do we sign up?
So you would just call our main office at the hospital in Salisbury, 410-543-7026, and they will set you up with an orientation. You'll meet with somebody, talk about the program, see if it's something you're interested in, and then they can schedule you your first day to kind of get a tour, and then from then on they can continue.
You're off to the races.
Thank you very much, Chris Evans and Tammy Donahoe. Thank you so much. Good
Thank you.
information.